Guys, this morning for the health of it, we're talking about healthy men. Yeah, testosterone. As we age, things change a little bit. The things that make us young and just fast and fun when we're 18, when we get to 40 or so, change. That's just life. But there are some treatments that can help maybe reverse engines a little bit of father time. Dr. Tony Chauhan and Kathy Ames from Balance Medical Day Spa join us. So we talked a little bit about what testosterone is, what it does, what it controls. But how can we, when we pass 40, start changing it?
You can supplement. There's bioidentical hormones. There's also hormone replacement therapy. And we're kind of focused just on men today.
Right.
So we have everything from natural supplements to actual prescriptions we can use to help rebuild your system.
Now, what about those ads you hear, you know, everybody and their brother is pitching the low teats, take these miracle pills over the counter. Is there anything more than placebo in that, or is there anything to that?
Not to a significant level.
Okay.
I mean, if you got to probably do the pellets or the injections.
Right. Okay. Yeah. If I'm looking for treatment, then what do I want to be looking? What kind of questions do I want to ask you guys, or wherever I decide to go for my testosterone treatment? What questions do I need to ask to make sure I'm getting the right stuff?
Pretty much what your program is. Like a lot of this is based on personal symptoms. Okay. You can have everything from mental fogginess to fatigue to irregular sleep patterns, to lack of muscle, slow metabolism, lack of libido. So kind of what a program's going to do depends on the symptoms of the client coming in.
Okay, and you may have one or all of those. So you could have a high libido, but maybe it's really atrophy strikes in, or vice versa.
So it's kind of figuring out. We have to initially usually do labs.
Okay.
Like the consultation to discuss it is free.
Right.
We have to kind of figure out where we need to go with it from there.
Okay.
You know, if you qualify for a program or not.
Right. So. And you look at that, and then you say, okay,
the medical side of things. Yeah, you got to look at the medical side of things, whether this patient is worth the risk taking going on.
And it's an ongoing thing. It's not like I can't take a couple of Advil and my headache's gone. I can't take a couple of pills and be done for the next 6 years. It doesn't come back. It's an ongoing process. It's doing
it cautiously and carefully to make sure your system, you don't want to overload your system so your body will not produce its own natural levels. So we have like a natural HGH gel that we're going to start, men and women can use, you know, to help increase and you know, all these other factors that people are facing over 40.
Sure. And we're 40, gentlemen. Like Tony and I will be there in about 10 years, right? But just talking about testosterone and the actual impacts it can have on our overall health. We'll put links for it at abccolumbia.com about testosterone, questions to ask whoever you want to go see, providers. Of course, you can see our friends here at Balance Medical Day Spa, wherever you decide to go for that treatment, or at least the evaluation, and then perhaps the treatment. Tony and Kathy, guys, thank you so much for joining us this morning. I'm going to go out and lift some cars. I feel like...
The gym's next.
That's right.